Got it. Okay. And it only took 8 minutes. Yay! All right, can hear myself. Turn this off. Double check. 8 minutes. Yay! All right. Thank you for sticking around to watch me fumble through this. As I was saying, I am Joe Tillman. This is the Joe Tillman Show. Normally, this is Spencer Kobren's The Ball Truth with me, Joe Tillman, as the co-host. But like I said, Spencer had some things to do, so I'm going to be taking your calls. I think I got that set up properly as well. And we're going to talk surgery. And the numbers are down at the bottom. You got North America. You can call 424-354-4284. And then down at the bottom, you've got United Kingdom. You can dial 44-190-557-1141. And yes, FSK, this is only on YouTube. It is not on other networks. Couldn't get all that going. Almost did, but I'm a one-man show today, so I couldn't do it. One thing I want to talk to you about while I'm waiting for the first caller is, and before I do that, I need to actually fire that up. Hold on one second. Forgot to get something set up. There we go. That should do it. Okay, so phone lines are open. Again, that's North America, 424-354-4284, and United Kingdom, 44190-557-1141. So, I want to give you a heads up about the next hair transplant class video. It'll be episode 17, and it has something to do with some of the politics that's going on in this industry right now. And the politics has to do with technician-based surgery, automated device-based surgery like the NeoGrafts and SmartGrafts and AlphaGrafts, the robots that are out there like the Artist system by Restoration Robotics, and then you got micromotor-based hair transplant surgery, and of course you've got manual hair transplant surgery. And what these represent are the 4 types of FUE hair transplant surgery that are available to you today, and that's what the video is going to be talking about. Those are the manual systems, motorized systems, automated systems, and robotic systems, currently being singular. And I think that this is a really important subject for you to learn about, because the type of procedure actually indicates the type of doctor or clinic that you'll be going to. And I can't do the whole video. Actually, I can do the whole video here, but to give you an idea of what it's going to cover, you're talking about manual FUE, which is the oldest form of FUE. It's the original form of FUE. And in my experience, when you're looking at manual-based FUE clinics, those are usually clinics that have been around for a long time. They've been performing hair transplant surgery for a long time, and they usually have experience with strip surgery, other forms of FUE like different types of motors, and they've settled on manual because in their hands, in their clinic, they feel that's the best option. And I find it, and you'll learn in the video, and you'll hear throughout this part of this broadcast that it's interesting how each tool has found its way into each type of clinic, and it's not a blanket application. So you can't say, well, if it's a manual or if this clinic's using manual FUE, they've obviously been doing this for a long time, but the probability of them having performed the procedure for a long time is there. That changes when you get into various forms of the alternative methods of FUE, such as your motorized FUE systems. Now, that is a subcategory because you've got your cheap motorized systems and then you got your expensive motorized systems. And the expensive motorized systems include different systems like the WA system, the PCID system, the I think the UGraph system, a few others. And those are systems that are usually also used by clinics that have a little bit of history to their existence. They may have been strip clinics at one point, or they may still be a strip clinic even today. And they've experimented. They've used multiple systems, and they usually do change to new systems when a newer system comes out that they feel is better. But the cheaper micromotor systems, and I'm talking about the ones that are maybe a few $100 and you can buy in Alibaba, those are almost always found in clinics that are fairly new to the game, don't have much experience in the past with other forms of hair transplant surgery. Whoop, and we got a call coming in. All right. You there? Okay. I'd love to, but of course no one can hear you ask me that. I know. I gave up. I can't. Well, let's see if we can hear you now. Here we go. Nope. I guess I could try that. Call back. Bye. We're trying another tactic, people. All right. Speak.
Dude, I am just about to walk into the strip club, and I wanted to make sure you can get at least one phone call in.
Let's see if that works.
Somebody had to hear that.
Okay, give me a check.
Check. We have sound. All right, so this is what you're going to have to do. You're going to have to get some duct tape, and you're going to have to connect your phone with duct tape, to your microphone. And then you're going to have to give out your personal number.
Ain't happening. No, I got my phone up to the microphone on speakerphone.
I can see that.
Yes. Yes, you can.
So boys, I just wanted to call in to say hi. Sorry that I missed doing the program today. I wanted to give Joe his props and a little support. As you can see, this is not an easy thing to do.
No.
And he's doing a pretty damn good job. I have a feeling next time, I'm sure the phone systems will work.
It will. I'll make the investment because this is ridiculous.
But the video looks good. For God's sake, though, pull up your volume a little bit.
Let's see if I can do that.
What's up, Nico?
Okay. We'll see if this works.
In case you guys were wondering, had IHS member Dr. Scott Alexander in studio. He was here, and also, believe it or not, UK contributor to the Ball of Truth, Spencer Speck Stevenson, was in the studio as well. And I'm not going to tell you what transpired, during any evening.
I got pictures. I have photos. I have evidence.
But I will tell you this: I have a little bit of a headache. That's all I'm going to say, and it's not because I was aggravated.
Are you bloated?
No, actually, I was a little bloated for the first recording because I had to wake up really early after very little sleep.
Yeah.
But you got one good day of drinking in your week without looking like you're screwed up. If you go for two, it's over.
Then you're done.
Especially at my age, yeah.
Right on. All right.
Yeah.
Well, look.
All right. So I want you to continue to ask people questions. Hopefully, apparently I put a screeching halt to the show. So go ahead, do your thing.
No worries.
Congratulations.
Thank you.
On pulling it off for the most part.
Yeah.
And I'll be watching a little bit.
All right. Cool. Appreciate it, man.
All right,
Thanks for the call.
Easy, guys. Oh, you got it.
Bye-bye. All right, 424-354-4284. That is the North American number. So NJ in New Jersey, you can, I'll assume that's New Jersey. Maybe it's just your name. You can call in and talk to us about your Dr. Haber experience. And, of course, in the United Kingdom, you got the, 44190-557-1141. Give me a call. We can talk about stuff. This is The Hair Show with that hair guy, Joe Tillman, on his own with screwed up sound. Let's see. FSK, Joe, shock loss. Does it usually take longer for the shocked hair to come back as compared to the transplanted hairs? Not really. It depends on how bad the shock loss is, but usually what you're doing is when you're shocking it into the telogen state, and it usually comes back. My standard answer was always between 3 to 5 months, roughly the same time that the new grafts should start to grow. So more or less they'll come in at roughly the same time, but it's never guaranteed and it's never uniform. They don't all just start coming back at the same time. So keep that in mind. Nico, you should call with this question. You've got the number. Make use of it. Area code 424-354-4284. Give me a call. Ask the question. Let's see. Were there any other questions in the chat room? If I don't get a call, now that we got the phones working with duct tape and carrot juice, I don't know how much longer I'm going to stay on here because I do have things to do. I wanted to give you guys your hair loss fix, and I wanted to try and do this as a call-in show, and we can do that now, just not the way I planned. All right, we got a call. I think this is probably Nico. Hey, you're on the air. Who are you? Where are you calling from?
Hey, Joe, it's Nico. How you doing, man?
Nico, what's up, buddy? How you doing?
Good. Hanging in, Friday style.
like the party maniac you are.
Oh yeah, big time.
Yeah.
After a work week, I'm a little spent on a Friday, but can't miss the show. It's like my get home from dinner downtime. So.
Right on. I appreciate that. What do you think of my overlay with my phone numbers? I made that today. You like it?
Oh yeah, no, that's a good graphic. I was psyched on that. I was like, oh man, today Joe Tillman show's fully upgrading to greater potential than ever. So
I'm telling you, I got the lights kicking. I forgot to turn one on. I got the lights kicking. I got the microphone upgrade. It's the same microphone, but I switched from USB to XLR. I got the mixer, and I got all these neat things, but the audio isn't working the way it should. So what do you do?
Yeah.
What do you do?
You know, you do what you do with duct tape, baby.
Yeah, exactly. Sorry, I'm just see. Yeah, I thought I had my phone on Max FSK. Hold on a second. Yeah, okay. How's that? Give me a check 1 2, Nico.
Check 1 2. Check 1 2.
Yeah, I think that's. If that's not loud enough, then I don't know what is. I can't make it go any louder than that. So anyway, what's going on? What's the question you had?
I got a bunch, but that's why I was hoping for chat questions too. So I'll start with a simple one. I was going to ask about the transplanted hair that's still immature, or even when it's some year, 4 months, 5 months post-op. I'm noticing that it kind of tangles pretty easily, whether I'm combing wet or dry. Does immature hair tangle easily?
Not sure. I'm not sure I understand. Did you say miniaturized hair?
No. Transplanted hair that's still immature.
Oh, okay, got it.
Yeah.
Yeah, I mean, immature transplanted hair is oftentimes it looks kind of kinky, or it's got some sort of maybe even a wave that the rest of the hair doesn't have.
Yeah.
Badly.
But it tangles too when I comb it.
Yeah. Usually that's I mean that's a characteristic that I've seen quite a bit. It didn't quite happen with mine, but my hair is like even the old work I had. It never got kind of kinky like that or wiry. It was wiry at first, somewhat,
yep.
But that resolved itself over time. But there's also the training issue. I mean, you do
right.
have to train your hair. You shouldn't have to train your hair. And I need to clarify that because there's a doctor that was telling a patient he was only 8 months out, and he's trying to tell a patient, well, you have to train your hair over the course of a year and a half to 2 years or something like that for it to lay down. And the problem is that it's complete horseshit because the work that this guy got, it's you saw the hairline video I did. It's like that, like mini micrografting from 20 years ago, and the angles are standing straight up. And so he's completely full of shit telling this patient this, and that's, I mean, the patient's work looks just like mine. It's scary.
Wow.
It's scary to look at his hairline because it takes me back.
Trauma.
Well, not so much trauma. It's like, but kind of. It's like, holy shit, that's what mine used to look like. A little less density, but it's the same characteristics where the hair is standing straight up. It's multi-hair grafts. There's a pattern to the placement. The clinic and the doctor in the UK, and it's in those kinds of cases, no, it ain't ever going to get better. There's a little bit of a training effect, but you can't make a big difference. But in general, when your hair is just immature and it's and you got that kinkiness, you got that a little bit more of a curvature or a wiriness to the hair, it takes time. It should sort itself out. Yeah.
Cool. I just noticed that I got tangled, so I was like, oh, what the fuck's up with that? But okay. Can I grab a couple more quick questions, hopefully, while I got you?
There ain't anyone else on the line.
All right.
Yeah, go ahead.
If I can take advantage. So just as a quick question, I mean, I always check your glossary and whatnot about, things like cobblestoning and ridging. Does that shit actually hurt when you do have cobblestoning or ridging? Because I guess since it's trauma or scarring, I assume it does hurt.
That's a great question. That's a really, really good question, actually.
Thanks.
It's you're welcome. Good job. It's variable. I mean, it depends on the patient. Mine, I had some pitting. I had some cobblestoning, not so much ridging. But some people do report tenderness, and that comes from an issue where the nerve endings are inflamed. They might be pinched somehow from the buildup of scar tissue. It can resolve. I'm a believer in the self-treatment arena as far as that goes. You can massage the scar tissue, and that can help with blood flow, and it can help with remodeling and healing. You can do derma stamping or derma rolling on scar tissue as well, and that can help it. But if it's deep, there's really, if it's a deep issue, what I mean is not so superficial, but deeper down into the tissue, then it's more difficult to resolve. It might resolve over time, but it just depends on the patient. So it does happen, but it's not universal across the board.
Cool.
Yeah.
Cool, man. No, I'm just trying to get information. I guess my final question, which is more relevant to my case, is, and I'll see if I can try to make the question easy to ask, is, I had a strip. There's one area that's still, one side rather, that's still kind of tender. So I pondering down the line whether I suck up some of that pain and then just do some FUE where the shock loss was. But I guess the question is, if I did do a second strip to hopefully get some nerve, some feeling back, sensation back, because there was some shock loss also in that area, will a second strip maybe bring the areas that are denser, the ends that are denser together, so that the appearance of less shock loss? Does that make any sense?
It makes a lot of sense. Yeah. So what you've got going on is you have a patch of your donor scalp that has a much lower density than the other areas of your scalp, correct?
Yep, and it's also still sore.
Yeah.
Go ahead.
Okay. So I'm breaking this down for the viewers and listeners. So there's scar tissue in the center of this thinned out, shocked area. Yes.
Yes.
Okay.
Exactly.
So your question is, it's a very logical question. Another great question. Your question is, if you cut out that scar tissue, and how wide is the scar in that specific area?
not wide really, because I had a 2,300 strip graft, so not a huge strip.
The graft numbers are irrelevant to the size of the scar. Just so you know, the graft numbers are irrelevant to the size of the scar.
They are, yeah.
All right, so the question is, if the scar is removed in a secondary strip, will the closure potentially bring that or reduce the size of the area of shock loss? The answer is yes.
Yes.
Assuming that there's no additional shock loss from the secondary procedure, right?
Right.
So you have to understand that the shock loss of the donor region after a strip surgery is not. There's not a blanket reason for why that happens. It usually happens because of one of a few reasons. God forbid, multiple reasons combined. Reason number one is because it's a tight closure. Okay.
Yep.
And when you look at a donor zone that's been closed under tension, it's the same thing as applying pressure on any part of your body. You watch TV, you watch movies, you always see someone getting injured and someone yells, "Put pressure on it." Well, what they're doing is they're saying, put pressure on it because it pushes blood flow away from the wound so you're not bleeding as much, right? So it's essentially the same thing when you have a tight donor closure. You're putting pressure, or the wound is putting pressure on that specific area, and it's reducing the blood flow, and that's why you get shock loss in some cases of strip surgery, because the tightness is like a pressure pushing that, or preventing that blood flow from returning to normal. Okay, so the hair is like, what the hell? Where's my food? And it just kind of it sheds, it falls out, and a lot of it doesn't come back. Okay, sometimes it does. There's a good percentage of times when it does come back, but if it's a perpetually tight closure, in other words, it doesn't loosen up over time, then the likelihood of that hair thickening is not so great. Not impossible, but just not so great. So that's one reason why people get shock loss or can get shock loss from a strip surgery. Another reason is transection of the neighboring hairs when that strip is removed. So, and this is something I never understood about some doctors, but having been involved and watched and recorded and documented so many strip surgeries in my career, I've developed, how can I say this? I've developed a fascination with how when you prep skin tissue properly, how you can cut through it. I sound like a fucking serial killer here, but how you can cut through it and it just kind of, it unfolds. It kind of falls away. It's the doctors understand what I'm talking about but when you do it right, it is actually fascinating to watch. And it's almost like, I don't know, it's kind of weird how much I enjoy watching it, but when it's done right, you're not going to transect any hairs on either side of the incision. And giving away a couple secrets that some doctors might not know and a lot of people don't know, if you tumesce that donor area and then you take the scalpel and you're pushing that blade, you have a much lower chance of transection. And so the reason why you tumesce when you inject into the scalp is you're puffing it up like a balloon. And what happens is when you puff it up like a balloon, those follicular bundles are spread apart. They're pushed apart. So, it's like if you take a balloon that's not been inflated just a little bit and put a bunch of dots on it, you blow it up, those dots are further apart from each other, right? So that's how transection is greatly reduced to its greatest potential, or its least potential, I should say, during strip surgery, tumescence. So if that was done, then you don't really have so much of a chance of transecting and destroying neighboring hairs in any given area during the strip removal. If there isn't tumescence, it doesn't mean that you're going to still cause peripheral damage or collateral damage, I should say, but the likelihood is higher. And not to mention, when you are pulling the scalpel, you can't really see where you're going quite as well as if you're pushing it. So imagine driving a car through a bunch of trees. You can better guide yourself as opposed to going backward, looking over your shoulder and trying. It's the same kind of thing when you're pulling versus pushing the blade. So maybe not such a great analogy, but hopefully you understand what I'm saying. But but that's one of the reasons why you can get shock loss in the donor area after a strip surgery is if you're creating transection to a lot of tissue or a lot of grafts outside of the donor wound, and that can also come from being too aggressive with what do you call trichophytic closure. It can be caused by undermining, which is a whole other issue with strip surgery. But in general, there's a couple of reasons why you can have shock loss in the donor area, and it comes from tight closures. It comes from transections. It comes from trauma overall. But when you're,
and it also comes, Joe. Oh, sorry. Go ahead.
It also, and this is talking about permanent shock loss. There's also temporary shock loss where it's just an interruption of blood flow in general. The area can thin out, but it comes back roughly the same amount of time that the grafts start to grow. So that's another type of shock loss. It's just the way it works. So I hope that answered the question.
Well, yeah, I mean, I guess for me, because when I saw it with my doctor, the main area of shock loss, I think, was pretty much caused by trauma from the suture, the first knot, and then there's some neighboring shock. Also, when I came in for a consult, he said, well, I had a double layer closure, so it couldn't really be a tight closure. And I was wondering, well, couldn't it still be closed kind of tightly? I might have had a tight scalp. He also uses Hylenex. So I don't know if any of that stuff factors in, but just thought I'd throw those details at you.
Well, I don't want to. I mean, I can't really. I mean, it's difficult for me to contradict what the doctor is saying, but I can say
Sure.
a double layer closure doesn't mean that it's not a tight closure.
That's what I assume.
A double layer closure means that it is closed superficially, visibly, like
right.
you can see the stitches, and then it also means that it's closed deeper down inside the wound. So it's actually closed double layer. It's closed
right.
down below, and then superficially on the top. So it doesn't mean that it's not tight.
That's what I figured. Yeah.
It just means that it's going to be more secure as it's healing, because he used dissolvable sutures, which is why you don't have to go in and have them dug out later on. May or may not have used dissolvable sutures for the superficial wound closure, but I would respectfully disagree that it doesn't automatically mean it's not a tight closure. It can be a tight closure. It can be a loose closure. Doesn't matter. Double layer doesn't indicate one way or the other.
And so that I can let you go, is that why some doctors use staples over sutures?
I've not seen staples used on top of sutures. I've seen staples used in double layer closures where it's a suture in the internal closure and then staples superficially. That's actually how Dr. Wong does it in a lot of cases. But putting the staples on top, superficially on top of an already superficial suture closure, I've never seen that before, and I wouldn't know what the benefit would be.
I meant one or over the other. Is that why some doctors use staples instead of?
Oh, okay.
Sutures.
Misunderstood. Yeah, no. Well, some doctors use staples over sutures because they feel that it's easier, it's faster. You don't have to tie the knots. You don't have to sew the sutures in. But a lot of doctors that are used to using sutures, they're really fast at it. So it's not so much a time issue. But the thing about staples that I like is that they're non-reactive. It's stainless steel, and there's no way you can make it too tight. With sutures, it's like, when you're tying your shoes, you can tie it too tight. Same thing with sutures. Yeah. You can create knots in the tissue actually.
Exactly. That's what I think happened to me.
Well,
and why I have shock loss in that area potentially. Sorry, go ahead.
Maybe. I can't say one or the other, but I mean that's the potential is there. But at the same time, with the doctors you went to, I think that the chance of it being too tight as far as the suture knot itself or how it's closed. Mm-hmm. I doubt that's it. It could be from too much tension. Every I don't care who it is. Okay, I don't care if it's your doctors. I don't care, Dr. Wong. I don't care if it's any doctor out there that's got a great name with the strip procedure. They've all had closures that were too tight, tighter than they expected. If anyone says otherwise, I'll call them a liar to their face. I mean, that's just either that or they've never done strip surgery. Or they've only done a few. But that's just the fact of the matter. You do it long enough, you're going to run into it multiple times, actually. So, So so again with the staples, I think that it's just it makes for a cleaner overall recovery. And
closure.
It is more painful than sutures. Make no mistake about that. But you tend to not have the train track scarring that can also occur, because even with the best strip closure, where it's just a real, if you're watching me, this thing with my finger means a strip scar. But if you have a really fine strip scar and it's closed with sutures, the likelihood of having matching rows of dots, one above and one below, is there, because of the suture, the presence of sutures, the point of entry and exit for the sutures. You don't really see that with staples. Again, non-reactive stainless steel. One person told me they did see it, but I've never seen it myself. So I'm not saying it doesn't happen, but I think the likelihood is lower. But that's just my personal opinion based on my own experience. So
nice. Thanks so much for the information, Joe. I'll try to sort it out with my doctor and get down into things a little bit further with him to figure it out. But thanks, man. I really appreciate the information. Man, you're the best. And fucking Joe Tillman show forever, baby.
Until we're back with the bald truth. I appreciate it.
You bet, man.
All right, thanks, buddy.
Talk to you soon. Have a great weekend.
Yeah, you too. Thanks now. Bye-bye.
Thanks, brother. Take care.
424-354-4284 in North America. In the United Kingdom, it is 44190-557-1141. And this is the Joe Tillman Show, and we do not have the phone lines actually coming into the audio system, so we're using my phone. Yes, you got access to my phone now, and I'm holding it up to the microphone. Yes, that's the way we're doing it, but it seems to work. So that's what we're doing for now. Got a question in the chat room from FSK, who has access to a phone, if I'm not mistaken, and he can call the question in at 190-557-1141. Give me a call. Anyway, what else is going on? Let's see, trying to think of other things in the industry I can talk about. Bunch of political stuff that you guys wouldn't be interested in, but I got to tell you, I wrote an article for FUE Magazine. You can have a look at it. I think it's fuemagazine.com. And I wrote an article. I think the title was Why You Might Not Want to Have, Why You Might Not Regret Being Bald in 2018. And I encourage all of you that are watching this and listening and eventually watching the repeats on YouTube to go to fuemagazine.com and download or look online at the latest issue, which is volume 2 or issue 2. Issue 2? Issue 2. Volume 1, issue 2. I'm not sure how it works. But anyway, it's the second one. And look for the article, Why You Might Not Regret Being Bald in 2018. And in this article, I'm talking about the fact that it's more dangerous for you as a patient to have a procedure today than any other time in the history of this industry. And yes, there were a lot worse procedures being performed 30, 40 years ago. But the problem is that in the grand scheme of things, they were isolated. It wasn't a very common procedure. It was a very uncommon procedure to have a hair transplant. But now it is more socially acceptable. You got celebrities talking about it. You have news outlets talking about it, and you have just about anyone and everyone that has a few bucks to invest can open their own clinic. Got a call coming in. Hold on. Hey, you're on the Joe Tillman Show. This is Joe Tillman. Who are you and where are you calling from?
Hi, Joe. Big fan. My name is Greg. I'm actually originally from Staten Island. I live in South Jersey. I actually sent some emails. I know you probably get a lot of emails. I was the guy talking about scalp exercises and low-level laser therapy.
You and about 30 other guys. How you doing, Greg?
Good, doing well.
Awesome. I appreciate the call.
I wanted to call and share my story.
Yeah, absolutely. Are you the guy in the chat room talking about Dr. Haber?
No.
Oh, okay. All right.
I actually just stepped out. I figured I'd give a call and try.
Okay. All right. Well, I appreciate that. Go ahead. Tell us the story.
Yeah. So I'm 36 now. I had actually started losing my hair around 21.
Uh-huh.
So I was in engineering school, and I remember waking up one day and seeing myself in the mirror, and I just saw that recession. And maybe I was in denial, but, I kind of didn't know what was going on.
Yeah.
So then I kind of, went about my life, and I never really, it never brought me down to, a point where I couldn't live my life.
Good.
But I, even to this day, I'm constantly thinking about it, maybe 20% of the day or so. So I think for about, 2004 I graduated, so probably 8 years. I didn't do too much, just, herbal supplements and lots of snake oils and everything. The usual stuff.
And it just kept getting worse, didn't it?
Yes.
Yeah.
It just got worse. And right now I'm a Norwood 3. I'm probably, the pattern's like a Norwood 5, but I still have hair all over the top of my scalp.
Okay. So a diffused Norwood 5 and actual Norwood 3.
Yeah, that would be my guess. And
okay.
Even without a microscope, I could see all the vellus hairs in my juvenile hairline.
Okay. Now, were you diagnosed? Did a doctor or hair loss professional give you an assessment as to where you are on the hair loss scale?
Not until recently, but I can kind of see it myself, the way it progressed. And when it first started happening, no one really believed me. So. It's kind of difficult. You don't really have anyone to talk to.
So you're losing your hair, and no one believed you.
Yeah, it's so subtle at first that
how screwed up is that?
Think you're crazy.
It's affecting you, and you know it's happening, and people are like, I don't believe you.
Yeah, they're like, no, it's fine. You're not losing your hair.
No, I get it.
Yeah, so it's. It's a struggle, and but so for all those years, I was I think it's Provilis and all those other things that were out there. I tried,
and why didn't you try finasteride at this time?
So I didn't know too much about it because when you would Google stuff back then, you wouldn't see anything about. At least I didn't. Maybe I wasn't looking in the right places. But you didn't really see too much about finasteride. You just saw Rogaine and then Provilis and all that other stuff.
Yeah.
And of course, I ended up buying some kind of, electric comb. And it should have been a clue because later on, I would say a month using that, there was all hair all over that electric comb. But I remember being so excited to get that, and nothing really worked. Then 2012, actually I should back up a bit. I was on a camping trip with some friends in college, and that was actually the first time someone made a comment, and I'll never forget the comment. I was actually hiking with them, and I walked into a branch, and it cut me on my forehead.
Yeah.
And I remember one of my friends was like, "Oh, look, Greg has a cut in his receding hairline." And that was it.
Did you push him off a cliff?
And that was it. So,
did they suddenly trip off a cliff?
No, unfortunately not.
Damn, you missed your opportunity.
But, I know, right? But yeah, that was it. That was when people started noticing. Then I started becoming more self-conscious about it.
Yeah.
And throughout all those years, it's not tough, because you grow up, you get I was made fun of for being Jewish, and then having freckles, and then being chubby. And then you go through high school and everything's fine, and join a band, all that stuff, and then all of a sudden
you're a band kid too? Jesus, man, you didn't give yourself a chance.
Yeah. And then I joined a rock band in high school though.
Okay, well there you go. Okay, all right.
Yeah.
All right.
So at that point, everything was going well, and then of course in college that happens. Senior year,
yeah.
You're still on Look for Girls and all that stuff. But anyway, so 2012 came, and I found Spencer Kobren's A Bold Truth, started listening to it. I went to see my doctor to get on finasteride.
Yeah.
And he didn't want to prescribe it to me because he basically said, I don't like to prescribe that because, you know, your hormones are who you are, et cetera. And I kind of understood that. He basically told me to shave my head or get a hair transplant. So at that point, I saw online, I saw the iGrow laser. And it was interesting, like, it didn't do too much, but where the lasers actually hit, I noticed, like, all of a sudden a vellus hair would just break out and grow, like, maybe like an inch.
Okay.
So the LEDs weren't doing much for me, but I knew there was something to it. So then I started, you know, digging into homemade laser helmet, and I really think that those have, you know, slowed down my hair loss. And I would say, like, in a month of using those types of devices, I definitely saw, like, a darkening and thickening of my hair.
Right.
And I was pretty impressed, and everything was fine, you know, moving along. And then all of a sudden, like, last year or 2 years ago, it really started to thin out up top. And at that point, that's when I actually heard the advertisement for Keeps on the radio.
Okay. Yeah.
So I got a prescription 6 months ago where they officially diagnosed as male pattern baldness. And I would say, it sounds crazy, but within like 3 weeks, I saw the type of results I was seeing from the laser helmet. Like it seemed like darker and thicker.
Okay.
And I've been on it about 6 months now, and it just keeps getting better.
Hot damn!
So
I love hearing that. Yeah.
Yeah, it's great. No side effects. I would say, if anything, the little hairs on my back don't grow as fast, so that's a good thing.
Well, you know what? That's a correlation that I've noticed. I remember talking to Dr. Hassan years ago about this. He was noticing it on himself. He was noticing that body hair wasn't growing as fast, and there's correlative evidence out in the wild where that's the issue. And oddly enough, doctors that are talking about doing body hair transplants, they recommend patients on finasteride stop taking finasteride because they don't want to hinder the body hair growth in their scalp, which is kind of a double-edged sword, if you ask me. But interesting observation. Yeah, you're just one of many that have made that comment.
Yeah, I haven't noticed. My facial hair has been growing fine, but like it's not that I'm losing body hair, but like I noticed that it's a slower growth.
Right.
And no other side effects. If anything, the sex drive is actually up. Of course, the first night I took it, I had to test the equipment. I got all nervous. So, I don't read the forums that much, but of course, all the things you hear. But yeah, everything was fine.
Okay.
And yeah, things just keep getting better. And I really think the combination of laser helmeting and finasteride seems to do the trick. I'm looking forward to where it takes me over the next year or two. If I had to do it all over again, of course, I would have jumped on finasteride as my first defense.
Yeah.
Because to see how quickly I started responding to it was pretty impressive, and it's pretty amazing. I maybe jumped on laser, later on down the line. The thing that really bothers me about finasteride is how easy it is. All the stuff you do, putting stuff on your head, all these herbal formulas and all that stuff, and shampoos you buy. All you gotta do is pop this little pill. It's smaller than an ibuprofen.
I got to hand. First off, I like the new verb that you came up with, laser helmeting. I've never heard it like that before. You just came up with a new verb. I love that. I'll be laser helmeting as I summer at the Hamptons. But I got to hand it to Keeps, man. Those guys. I don't know if they intended it to come across like this, but they're making finasteride cool again. Because the way that they're presenting it, a lot of guys are finding it and not realizing it's the same thing that people have been bitching about, trying to say that, it makes your left nut fall off for taking it.
Oh yeah.
I mean, there's I'm sure that you ran across some sort of mention of side effects in literature or discussions or something. I mean, please tell me that something like that was mentioned to you.
Oh yeah.
Okay. All right.
They say it right on the website. I've actually read the physician's desk reference as well. So I looked into it. And,
okay, you're a little more thorough than the average guy. I gotta say that, because not many people will find the physician's desk reference. But the point being is that you found them, and that's apparently their approach is what triggered in you that you needed to try it. Is that a fair statement?
Yeah, I would say that. Sorry to cut you off. Yeah, I would say that it's not that I was so afraid to take it because of the side effects. I just wanted to do other things. Like I couldn't picture myself being on medication.
Right.
For hair loss. But then I was thinking to myself, you know what? I'm constantly looking for things online, herbal supplements, all these types of things, and it's really not going anywhere. And I'm like, if I spend this much time and money, and then thinking about my hair loss, I'm like, why don't I just go with the thing that I know, based on studies, should work?
Yeah.
And then I saw Keeps, and so it wasn't that I was so afraid. It's just it made it so simple that I didn't have to go to the doctor and kind of beg. And you talk to a doctor who has a full head of hair and they don't understand.
Yeah.
And it's just so simple. They have great customer service. I was out of town for a few days and my delivery was supposed to come, and I didn't want it to be sitting out in the heat. And I gave them a call, and they rescheduled it for a few days earlier. My prescription, and I'm really impressed. And again, like the thing that bugs me so much is that 14 years basically have passed by, and there's something so simple. I was already taking herbal supplements. Now all I have to do is take one pill essentially. You
came to the same realization that thousands of guys come to as well after spending God knows how much money, probably thousands, on useless remedies and like you said, snake oils. And you're not alone though. I mean, it's like there's so many people that have been through the same thing. I mean, this is hair loss, dude. This is like one of the slimiest, easiest to get into industries as far as pushing products. All you have to do today is set up a website or go on a forum and start talking about, or go on Reddit and start talking about your own homemade witch's brew.
Yep.
Yeah, can you hear me? Hello?
Oh, yeah.
Yes.
Yeah.
Can you hear me? Yeah, I can hear you fine. And start talking about, give it some name, some RX 327 or whatever, and people will start buying it. People will start buying the recipe that you want to sell them. It's amazing to me, but at the same time it's really sad. And I kind of did a little bit of that at one point, but not much. I was kind of like you, like you're saying earlier on in your discussion. You're saying that it bothered you, but it didn't bring you down too much. That's kind of the way I looked at it. I kind of accepted the fact that there wasn't anything out there that was worth a shit. Finasteride was available, but not as Propecia. So I didn't know about it as Proscar. And Rogaine was out. I tried that for a short while. Read about the side effects, and that scared me because I don't want cardiac issues. So I just kind of accepted it. I accepted and oddly, I didn't look into this stuff until several years after my second hair transplant, which, if you know my story, was really bad. And so that's why for 9 years I walked around with that bad hairline, and my hair loss continued and got really extreme. So I just accepted it. And I tried a couple other things, but they were cosmetic. Like I tried the good looking hair, GLH hair in a can that you'd get on late night TV.
Sure.
And that's about as far as I went. But your story is, it's kind of further along than mine as far as what you tried to do to deal with it. But it's so similar to tens of thousands of other guys out there. And then you finally realized, I could have been taking this pill. You know, a lot of guys don't look at it so simple. And I understand your position. It's so easy. Why didn't I do this before? I get it. It's just one little pill or a quarter of a pill if you're taking the 5 milligram version. You pop it in the morning or you pop it at night, once a day, done, right? A lot of people will put it next to their toothbrush and they'll pop it right before they brush their teeth every morning. It's simple. You don't have to put anything on your head. I love that. But yeah, a lot of people don't look at it like that, and they're like, it's poison, you know. So good for you. I'm glad you came to this conclusion, and you're just starting your recovery with this. You're how far along? 6 months?
Yeah, just past the 6-month mark. I'm seeing like it almost looks like I have all my hair in my juvenile hairline. It's just vellus, but they lengthen.
Okay.
And then one day it doesn't look like anything's going on, but I'm noticing like the top of my scalp is getting darker, and you know my posterior, when I lift my hair up, it feels like a boar bristle brush now. Like it's pretty. Wow. I can tell a difference there as well. It's pretty amazing. So the things that work for me are finasteride and laser therapy.
Yeah.
And I would also have to say that another supplement, I know you've talked about it, curcumin or turmeric.
Yeah. Mm-hmm.
For anti-inflammatory in general, but I've noticed that my skin and hair looks better when I take that as well.
Yeah, because and the reason why I think that is because a lot of people don't even realize they have a chronic low-grade inflammation just from the regular foods that we eat. A lot of the foods that we get from the grocery store and from God forbid, from vending machines, it's just crap, right? And even stuff that you think is good for you, because of the way it's packaged and marketed, like granola bars, is horrible for you. Like in a typical granola bar, it's like 8 grams of sugar, which is a mass. It's like, it's so bad. So, I believe that a lot of people have a chronic low-grade inflammation due to what they eat, and they don't even realize it. And it causes their body to kind of slowly and moderately, but over the long term, respond to that issue that's causing the chronic inflammation, and it's a cascading effect as far as I'm concerned. So curcumin, turmeric is an anti-inflammatory. It's very, very safe to take. I take it, or I don't take it as often as I'd like to. I keep forgetting to take it sometimes, but I believe in that. And for you to say that your skin and hair looks better because of it, I think that's a valid observation. Good for you.
Yeah, and when I look at my scalp I have a digital microscope, I do see like little red circles around each follicle, and my dermatologist said that maybe it's seborrheic dermatitis, but I don't really have flakes. So I think the curcumin helps with that as well.
Yeah.
And of course, like a coal tar shampoo. And I bought that shampoo you recommended, Pai Shao. It smells pretty amazing too.
Isn't it? Yeah. I just got another supply of it because my local chick that cuts my hair, she stopped carrying it. So yeah, I just get it online now. It's more expensive, but it is what it is. I think it's worth it. So
I don't want I'm not bragging. I don't want any guys to feel bad, because going through, like you said, tens of thousands of guys. Like, I'm a learned person. I'm a biomedical engineer with a bachelor's and master's, and I still didn't go for the FDA approved stuff. You know what I'm saying?
Well, so it's because you're in biochemistry or bioengineering that not to always look at the FDA for your solution. So yeah, it's good. It's good that you found it though. So I'm really happy for you. Did you say there was a consultation that you wanted to discuss, or was just your experience you wanted to discuss?
Oh no, it's just my experience.
Okay.
I just wanted to kind of share that with everybody and tell you guys, you and Spencer, I really appreciate your show. I could talk to my wife about it and stuff, but
she doesn't get it.
It's good to have guys vent with each other as well, and it's a therapeutic show. I like to listen to you guys. So.
Awesome. Well, I appreciate the support, and thanks for calling, especially on Duct Tape Fridays. That's what we're going to call it now. But Greg, I appreciate you calling. I really do, and thanks for the support. And you have a great weekend. Okay.
You too. Have a good show.
All right, buddy. Bye-bye. All right. Area code 424-354-4284 in North America. In the UK, if you're still awake, FSK, 190-557-1141. This is Joe Tillman and the Joe Tillman Show. I am that hair guy, Joe Tillman. And if you haven't noticed, if you're just tuning in, we're winging it with a phone in hand and microphone in my face. Now, we got a call coming in. I think I know who this is. Let's check it out. Hey, you're on the Joe Tillman Show with Joe Tillman. Who is this and where are you calling from? And we lost him. He hung up. Let's see. Make sure it wasn't my fault. It wasn't. It was your fault. Call back. Let's see. GOCSA. Hey, Joe, I threw a question at you on Twitter just the other day. Could you look at it when you have the time? No. Call the show. 424-354-4284. Or if you're in the UK, call 44190-557-1141. I'm just kidding. I'll look at it later. But you could call and ask the question. Let's see what else is going on here. Any other things coming through? Don't see them. Ah, here we go. UK guy calling back. Hey, you're on the air with Joe Tillman. Who are you? Where are you calling from?
Hey, this is FSK.
My man, how you doing?
I'm okay. How you doing?
I'm good, buddy. It's real late over there in the UK. What time is it now? About 1?
It is 1 o'clock.
Right on. And yes, you did catch my my announcement. I said 5:30 EST. It's supposed to be 6:30. So my apologies and thank you for calling me out on it. So it has to, exactly. Spencer's not here, so who the hell's going to do it, right? Yeah. So what's going on, buddy?
Yeah, that's true. No, nothing. Just chilling out in cold London.
Yeah. What's the temperature there right now?
Right now it's probably about 3 or 4.
Okay.
I think, maybe.
It's colder there than it is here in Vancouver, Canada. It's 7 degrees here.
Yeah, well, in the daytime it was about 14, I think.
Okay. Oh wow. Well, that's a big drop then. Okay.
Okay.
For the North America, for U.S. listeners, we're talking in Celsius, not Fahrenheit. So don't freak. It's not that cold.
Yeah.
So what's going on? What's on your mind?
It's got a couple of questions really.
Yeah.
One's about Demerona.
Mm-hmm.
I'm not usually a fan of stuff like this. I mean, if you asked me a couple of months ago about Demerona, I'd be saying just don't add it. No need for it. Just stick to Propecia, and that's fine. But I'm just thinking of using it on my temple area.
Yeah.
I mean, it's not that bad, my temple area, but it's a bit patchy. You can see a bit of thinning there.
Yeah.
So I'm thinking maybe a bit of Demerol, I might just give it a bit of a boost, maybe. And then maybe, once my transplant hair and everything grows in, and then, it might add to the whole final result as well. So I was thinking, what's your opinion of that?
Well, let me, before you get to the second question, remind me, when you had your procedure, it was 5,000 some odd grafts, right? And but even with that number of grafts, the doctor did not want to transplant into your temples. Is that correct?
That's true. Yeah.
Yeah, because your temples still exist, and he didn't want to go into that area because of possible damage. Is that what you said before?
No. What you said was there were two reasons for it. One was because of my odd type of hair loss. He wanted to use the grafts up top.
Right.
And the other reason was probably bigger reason was the fact that obviously you need soft hairs for the temples.
Right. Okay. Fair enough. Yeah.
And he said it looks like my hair's a bit, quite thick, so it might not look natural. But he did say he would do it if I really wanted to.
Yeah.
But I went with his initial gut feeling on that. So
well,
I didn't do that.
you potentially dodged a bullet on that one because putting coarse hairs into temples, if it's not done exactly right, then it'll be exactly noticeable. If that makes sense, it'll be exactly unnatural, right? There's a very specific way to work with coarse hair, and temples are the trickiest area to work with that tricky kind of hair. So you dodged a bullet with that, and so.
I think
think because of the way they operate, ASMED, it might have been a good idea that I didn't do that actually, because obviously they work in a larger team, and I'm just thinking maybe it might have been risky doing something like that when it's not the doctor doing absolutely everything.
Well, that's a whole nother discussion. I'll say this, and this isn't specific to ASMED and Dr. Erdogan or any other clinic. It's a generalized statement where when you're going to a clinic that really cares about the hairlines, the doctor. Okay, let me back up. I can't even say that's a completely accurate way to start, but I'll say that when you're dealing with hairlines and you're dealing with really tricky situations in the hairline, there are clinics that exist where the doctor is examining all the grafts that are going to the very front of the hairline, and he's how can I say, he's leading his team, training the team to also know what to look for, but he's double checking and making sure that as the grafts go in, they're not only the right kind of graft, but that they're angled at the right, in this is basically HT 101. They're also angled at the right direction as well, but also at the right rotation. Because a lot of times when hairs are growing, you see the shaft inside the follicle, there's a curvature to them. And there are some doctors out there, one of them I work with in your neck of the woods, he's actually looking at each individual follicle and he's rotating it so that the flow of the hair is uniform as it grows out. It's more than just angle and direction. It's also the orientation. That's the word I was looking for, orientation. I can't honestly say that's got a huge influence on the final result. But when you look at the results out of this clinic, I'm not going to argue with anything they're doing because it's fucking stellar. So my point being is when you're looking at the issue of technicians knowing what to do when it comes to those fine details and the fine issues that need to be addressed, I don't think that they've got, in many situations, I'll say most situations, they don't have the incentive because their name is on the door like a doctor does to make sure it's done right, if that makes sense.
Yeah, I get it,
Yeah. So I hope that answers the question.
Yeah, that does, yeah.
Yeah.
I mean, that actually wasn't the question, but it was about the derma roller.
Yeah, well, I was going to jump back to the derma roller. So my feeling on situations like yours, and this is more for this has more to do with people that haven't lost their hair in a specific area they're concerned about, which sounds like you still got a lot of the hair in the temple. I think it makes sense. There is evidence to suggest that derma rolling, or derma stamping as some people would prefer, can give you that boost, as you said, to where maybe it'll fill it in a little bit. It does work on some levels. I was talking to one doctor I used to work with quite a while ago, talking about the PRP procedure I went through with Dr. Cooley, which did have a net gain. And what Dr. Cooley does is he also recommends derma rolling after the procedure. He actually derma rolls during the procedure to activate the injections, but he encourages it afterwards as well. And another doctor that I used to work with said that he personally believes that while PRP can be great in the right hands, that derma rolling or derma stamping alone has its benefits as well on top of it. So I think that there's something to it. I've seen it myself. Doctors I know that are respecting the field believe in it to a small degree. They think that it can help. So why not? If you're bald, no, it might activate some hairs, but not enough to make a difference. But if you've already got a significant amount of hair in a given area and you want it to be thicker, then I think that there's something to it. Give it a shot.
Yeah, well, yeah. I mean, is there a certain type I should buy? Because I look online and there's just like, there's literally hundreds of derma rollers out there.
I use a half.
What type of size needle I should use?
Yeah, I use a half.
How often?
I use a 1/2 millimeter needle, and it's a roller. I'll show it to you right here. Hold on a second. Yeah, here it is. It's right here, and it is. See if I can get where are my glasses. See if I can read the brand. This is not an endorsement. It's just what I use because it was given to me. I did not go out and buy this. It is.
What do you use it of?
Every once in a while, when I think about it, and when I think about it for enough times in a given period, like over a couple of weeks, I do feel like it makes my. I'll use it my crown. I do feel like it makes my crown a little bit thicker. I don't really care that much about that. About my crown. I mean, it's covered and that's all that matters to me. I would like it to be thicker, but I don't care enough to commit myself to some routine that I have to do on a regular basis. I'm not that kind of person. So it just says Derma Roller, so I don't even know what the brand is. But it's just a 1/2 millimeter needle set, and it works. So other guys are talking about
Use it?
when I use it, it'll be 2 or 3 times a week. But I don't. But I'm not always remembering to do that. In fact, it's been a few months since I've used it. Full disclosure.
Is there a certain type of direction you should apply it? Because I don't want to sort of fuck myself up or anything.
No, just no. What I do is I don't roll it back and forth. I'll roll it once in one direction, lift, and go back to where I started and do it again. That's the way I do it. I don't know if that's the right way. I'm not keen on the idea of the roller going back and forth and potentially grabbing a bunch of hair to rip out. Now, if that happens, it's like it grows back. It's not a big deal, and it's not going to thin it to the point where it's going to be visibly thinner if hairs do get caught in it. But it's like, why do it? So I roll it once with pressure, lift it up, roll it again, the same direction.
All right, cool.
Yeah.
Yeah, I might just might look to do that actually.
Okay. Yeah. And they're cheap. They're like like for you maybe 5 or 6 pounds at your local chemist.
Yeah.
Yeah.
I saw something stupid for like £40 or something. Online. It was like ridiculous.
Yeah, it is ridiculous. Just go to Amazon or something like that. You'll be fine.
Yeah.
Yeah.
Also, did you get my email a few days ago?
Don't know. I just haven't seen it. I've been extremely busy. Let's see.
It was just it was a graft, I think, I was asking about. I took a picture of my graft that fell out. Oh, no, it wasn't a graft, sorry, it was just hair. But I was asking whether you think that was a graft or not.
I'm looking at it now. And no, I'm not going to put it on the screen. Don't ask me to do that, people. It's enough. It's enough holding the phone to the microphone to get this done. No. How did this come out?
So basically, so I felt like there was something lingering in my hair.
Okay.
So I just put my fingers through it, like I don't know, it felt a bit, crummy, if you know what I mean. So I put my fingers through my hair, and then I just sort of not pull out. It was already lying around.
Okay.
So it came out, but it's been nearly 2 months post-op. So I don't know what you think.
If it was just sitting in your hair and it didn't, like, you didn't pull it out of your scalp or something, I think it's just it almost looks like a sebum buildup, and those are hairs that didn't get knocked out that had already separated from the follicle. So
all right. If you look on the email, I copy pasted what the clinic told me.
Let's see. Okay, so
it's not on that email. It's actually the next email. I'll send you 2 in a row.
Yeah. Okay. So let me look at this.
Yeah.
Continuing. Yeah. Just to add what the clinic said, it's a hair with epiderm skin around. Okay. If the graft would come out, there would be bleeding. 2 months later, no, that's not true. Look, there is a chance that maybe it is a graft, and it just didn't take. and or it could be, and it's like, okay, one graft, big deal, or it could be hair. It could be the hair shafts that were shedding, and you didn't actually knock them out because maybe you're being too soft with your grafts to like you're babying them, which is really common.
Yeah.
And then
I was in that particular area. I was quite soft with them.
there you go. That's probably what it is. So don't worry about it. It's fine.
Yeah.
Yeah, you're fine.
Okay. Cool.
Yeah. It's a really common thing. And Rob in the chat room saying we can actually see it. Yeah, I get that. I realized it later on that my monitor is in the camera, so it's good. I think that a lot of people don't realize that even a week after surgery, they can be almost as rough on their scalp as they were before surgery. 2 weeks, absolutely. But 1 week, like say a solid 7 days, you don't need to baby your scalp. Now, this is contrary to what some post-op instructions will tell you from various clinics. I personally feel it's horseshit, but that's just my own opinion. I'm not a doctor. But the grafts are seated. They're after a week and a half, you have to get hit by a 2x4 for anything to happen. It's just not going to happen. So anyone else that's watching this or listening to it later on, you don't need to baby your scalp a week and a half after. I said a week earlier, but just be safe. A week and a half after your surgery. Always follow your clinic's post-op instructions. But if you bump your head, like if you touch your grafts more vigorously than you normally would at a week and a half or later after your surgery, you didn't cause any damage. If you knock a hair out, you didn't cause any damage. The hair's coming out anyway. So back to you, FSK. It's fine. You're fine with this.
Okay.
Not a problem.
But I mean, if the graft did come out, it wouldn't bleed, would it? Would it after?
At 2 months, no. At 2 months, no, because it means.
But it can still come out, can it?
Not in the way that they were talking about. No. The graft itself has been reabsorbed into the tissue, so there is no graft. All there is a follicle. The follicle might not take. The follicle might die for whatever reason, like maybe it was damaged during the placement and it just doesn't recover. But the hair shaft, the actual hairs that you see, they come out anyway, and the tissue is just reabsorbed into your body. So no, the grafts can't come out at 2 months. They can come out at 2 weeks. Or sorry, not 2 weeks, but they can come out several days after surgery. And that's when you notice bleeding. But 2 months, no, there's no bleeding. That means that you've cut yourself. Big difference.
Yeah.
Yeah.
All right. Okay. All right. Cool. Thanks for that.
All right. Everything else going well for you? Getting along okay?
Yeah, everything's all right now. I didn't go to the gym for about. Well, they told me I'm going to the gym for about a month. So I ended up going to the gym probably about 35 days, 37 days later.
Mm-hmm. Okay. I don't think it's necessary, but I mean I don't think it's necessary after an FUE procedure, but that's their protocols. So obviously it was best that you followed that.
Yeah.
But those.
I was feeling like shit as well, so I just don't even feel like going to the gym.
How's the recovery so far though? How's the donor area?
The donor area looks really good. Good. That's one thing I would say. I mean, I know as many a lot of people don't like texting extractions and all that, but one thing's for sure, they do take care of the donor area really well.
Well, that's one thing. Look, I don't work with Dr. Erdogan. I know him personally. I mean, I think he's a hell of a smart guy. He certainly knows how to put on a great show. He's got a beautiful clinic. He knows the art of presentation, and taking care of this is what's interesting. Taking care of the donor area is part of the art of presentation because it's all about aesthetics. That's why you're getting a hair transplant. That's why this industry exists. It's about aesthetics. It's about what we see. It's about the presentation of ourselves. And he's really got that down to an art and a science, with making sure that the donor looks as good as possible. Is it perfect? No. No doctor, no clinic is perfect with how they take out the donor hair from all their patients all the time. But he's at the very least, I can say that he's pushed the idea forward with this idea of homogenization that he and Dr. Jose Lorenzo came up with, and this coverage value for numbers of graphs that we can take it out versus, the type of results that they're looking for. So I'm not surprised for you to say that your donor area looks great. I'm really not, and I'm happy for you. I think that there's no reason why you're not going to have a great result overall. I know you're.
I hope so. Yeah.
Well, I know you're talking fairly recently. I think maybe I saw you on one of the forums talking about, or maybe you emailed me at one point talking about maybe going in. Oh, actually, it was in the chat room of the show recently, talking about having another procedure for a little bit of a touch-up. You may not need it. You don't know. It's only 2 months.
Yeah. So I mean, the temples is one issue, obviously, but hopefully, if Demerol can even just bring back some of the hairs. Yeah. I might not need to. Who cares?
Well, avoid a second surgery as much as you can. Look at the derma rolling. Let finasteride do what it's doing. When did you start finasteride? Didn't you say you started it fairly early? Or fairly recently?
Actually, no, I started it probably about a year ago.
Okay, all right. Well, you still have some potential.
I remember emailing you about that, actually.
Yeah.
And you said just to ease into it and worried about side effects. So I didn't actually start using it every day until probably about February.
Okay. All right. And that worked out for you.
About what? Well, obviously the past 2 months, I don't know because I had surgery.
No. I mean, as far as the side effects, you avoided side effects, right?
Oh, yeah. I've had absolutely no ball ache, nothing like that.
Yeah, good.
Nothing at all.
Good. And then, sorry, I lost my train of thought. And then the, oh yeah. So what I was going to say is, I don't think you need to be thinking about a second surgery right now. Avoid a second surgery at all costs until it's the only option. Don't get greedy. And I'm not saying you are. I'm just saying this, and this is for your benefit, but also for people watching and listening. Don't get greedy with a second procedure to seek perfection, because what you see as an issue, most people probably don't see as an issue, and you're probably just as handsome as you want to be already with your hair. And I think that you're going about the right way. You're trying the derma stamp or derma rolling, or you will be trying that. Maybe even consider looking at PRP into that temple region as well, with a clinic that has a track record that can show you results from their PRP treatments, and maybe try that.
I'm a bit surprised actually. I know Asthma do PRP as well. I don't know too much about their one.
I don't either.
I was a bit surprised he didn't offer that because I did have a lot of miniaturized hairs. That's what he said.
Yeah, well, here's the thing. It's like realistically, if you're going to be looking at doing a PRP to strengthen a lot of hairs that are being miniaturized, then it doesn't make sense to have a surgery at the same time, because it's like you have no idea if the PRP is actually doing anything. So logically, if you're able to step back in time and look at it, it'd be like, well, shit, if you're going to try PRP, then don't do surgery. Do PRP first and see how that works out. You might not need to do as much surgery, in a year as you do today, if that makes sense. Because if you're thinking it up considerably, it's like that 5,000 might need to be 2,000. But that's what's done is done. We can't Monday morning quarterback that. But going forward, once you reach your final result, which is roughly 12 months, 10 months from now, then you can examine, maybe doing PRP. I wouldn't suggest you do it now. I don't like compounding treatments. I'm hesitant to get you to try, or to hear you trying any sort of rolling or stamping at this point, because you're only 2 months. I think that the surgery needs to have time to mature on its own. You're still getting benefits in potential increase in efficacy from your finasteride use. It may affect it. I don't know. But that's your call to make.
Yeah, I don't really want to start even thinking about PRP, to be honest, because I don't even know that much about it. I just want to get to that 12 months to say 15, 16 month period, and then make a decision from there. But even if it means I'll only need to do, let's say, a couple of dabs of topic on my crown.
Yeah.
myself, I think I'd be quite happy with that. I mean, going from what I was a few months ago, where I was putting a lot of topic on, if I can just go to maybe just putting on literally a couple of dabs on the top of my crown of topic, I think I'd probably be okay with that.
Well,
and on top of that, I've only got probably about 2,500 left.
Yeah.
So I need to be really careful about what I do next.
Exactly.
If I do anything.
Yeah. Well, that's the whole thing. You know, you've got limited resources. You don't, you know, it's like a second procedure to get to the point of perfection could take you in the other direction as well. I mean, it's always a possibility. So, so that's why I'm always preaching surgery as the last resort. That's why Spencer's always preaching it as well. So that said, it's great to hear your voice again. Always appreciate when you call, and thank you for staying up late and your patience through this minefield of audio issues I'm having. But we worked it out. So this is officially the first phone-in version of the Joe Tillman Show. So there we go. With that said, I'm going to let you go. Thanks again for calling, and you have yourself a great weekend.
You too. Thanks very much.
All right, buddy. Take care. Bye-bye.
Bye-bye.
All right, everyone. So it is, what is it, 5:18? Yeah, so we've been on about an hour and not quite an hour and a half. Yeah, a little over an hour and a half. Most of it was dealing with audio issues, but I got stuff to do. It is Friday. I need to go get some dinner. I need to go walk the dog, and I need to run some errands, and I got more work to do. So, like I said, I just want to give you guys a chance to have your fix for the hair loss show, and I was hoping more of you would be, or I was hoping that the phone system would work out better, but you know what? We made it work. At the lovely suggestion of Spencer Kobren, just hold your damn phone up to the microphone. I did, and it worked. And thank you to everyone that called. Thank you for everyone that stayed and had the patience to see this through. Before I go, I'd like to thank the supporters of this broadcast, starting off with international-hairlossforum.com. It is primarily a French-based forum. I do recommend that you check it out anyway, because images know no language. You can look at lots of pretty photos of lots of people that have their own hair transplants, and with most modern browsers, it'll translate it into the language of your choice anyway. So check it out. Tell them Joe sent you. That's international-hairlossforum.com. Next up, we got bellycapelli.forumfree.it. Sniffle. That is the Italian-based forum. Again, modern browsers will translate it for you. Lots of pretty photos to look at of lots of patients that have had lots of surgeries with lots of different clinics throughout Europe and the world. I do highly suggest it. Great guy that runs it. Good friend of mine. Repair patient. Supports the message. Supports the program. Lets me broadcast through his web property. That's bellycapelli.forumfree.it. And we got hairlossexperiences.com. British-based, worldwide exposure, great resource. They also support this broadcast. We are streaming live through their web property. Great resource to interact with other patients. Also look at pretty pictures from clinics and patients alike. That is hairlossexperiences.com. And of course, my website, hairtransplantmentor.com. I am sometimes known as the original hair transplant mentor, and that site will explain why. Home to the most comprehensive and extensive hair loss and hair transplant glossary on the interwebs. I highly recommend you bookmark it for that reason alone. hairtransplantmentor.com. The other websites, International Alliance of Hair Restoration Surgeons. If you're a doctor on that website, you got the baseline qualifications to be on my website. Great resource for finding doctors that are basically a safe place to start. Great information, great forum that goes along with IAHRS.org. That is Bald Truth Talk, the most trafficked hair loss and hair transplant forum on the interwebs that does not have a back-end system, and it is growing like crazy. Not crazy about forums in general, but the ones I'm talking about are great places to check out. There's also American Hair Loss Association, consumer-based organization. Great information. The most referenced resource on the web by major mass media: Wall Street Journal, Men's Health, NBC, ABC, you name it, they've all referenced the American Hair Loss Association. So check them all out. Until next time, folks, it'll be Tuesday. At the normal time, we'll have The Bald Truth, Spencer Kobren's The Bald Truth with me, Joe Tillman. Until then, have a great weekend, and thanks for tuning in. Take care.